First, before I discuss our revised public health orders, I'd like to let people know that we received a limited supply of remdesivir yesterday from the Department of Health and Human Services. Remdesivir is an intravenous drug that may help some patients with COVID-19. At this time, remdesivir is only authorized for use in patients who are seriously ill and in the hospital. We have communicated with Wyoming's hospitals and providers about the supply and how to request it. We've received notice that more shipments of remdesivir are planned for Wyoming, but we do not yet know the details of when or how much we will receive. We've taken some big steps forward in the last few weeks, and with the new orders that go into effect Friday, and I'm very pleased that that's been possible. But we must continue with our thoughtful and measured approach. We need some time to see how the changes we've made in our orders affect our situation. I believe our actions have helped Wyoming by preventing the disease from overwhelming us. You just have to look at the news to see how this has happened in many other places around the country. I know that this has been difficult, and I hear from people every day about their frustrations. More businesses and programs will be able to operate with these new orders. Of course, because this disease is unfortunately still part of our reality, the way we do things can't yet be the same as they were before this pandemic began. Social distancing remains critical for now and will for a while to come. Keeping our distance from each other helps us slow and limit the spread of this disease so businesses can remain open. The restrictions spelled out within the new orders are meant to encourage safer operation. Screening of employees for potential illness is an example. We advise employers at various types of businesses to do this by asking them about symptoms and contact with ill people with COVID-19. Cloth face coverings can also help slow the spread of the virus and help people who may have the virus and don't know it from transmitting it to others. The use of these coverings in certain business and community situations is clearly described within the revised orders. For all of us, it's good to know if you wear a face covering and you have the virus but no symptoms, that face covering can help prevent you from giving the virus to somebody else. Face coverings aren't complicated and they aren't medical masks. They can be any cloth item that covers your nose and mouth while still allowing you to breathe. We recommend face coverings in public settings where other social distancing measures are difficult to maintain. Using face coverings as recommended can help allow us to keep moving forward. The order affecting gathering size has been changed to allow groups of 25 people rather than less than 10. There are also some specific guidelines that will allow higher numbers of people to participate in faith gatherings and funerals. The size change for gatherings is significant, but does not allow for large events. There's a reason we have to be thoughtful and measured about gatherings, and it's simple. More people means a higher chance that someone is there who is infected and may not know it. And more people around an infected person means a higher chance of more transmission among the people at the event and then through the community. As has been the case all along, county health officers have a role in applying Wyoming's public health orders and requesting exceptions. Exceptions may cover individual businesses and specific activities, and county officials are aware of the process to follow. I will continue to give every exception request a fair review. But these orders make significant changes already to the restrictions that we've had in place. So I don't want to create an expectation among people that everything they may request will be approved. There should also not be an expectation that countywide variances that are significantly different from these new orders will be reasonable at this point. Again, we have taken some big steps and need to see how things go before we take more. Remember, pretty much anyone can get sick with COVID-19, anyone has a chance of serious illness, and anyone who is infected can pass COVID-19 onto others. Unfortunately, we know that certain people have a higher risk of serious illness. Older people and people of any age with health conditions that mean they have a higher chance of getting seriously ill should still avoid close contact situations. Those health conditions include chronic lung disease or moderate to severe asthma, serious heart conditions, compromised immune systems, severe obesity, diabetes, chronic kidney disease requiring dialysis, and liver disease. People who live or work with persons who are more at risk for becoming seriously ill should also seriously consider whether they participate in any activity or event that involves close contact with others. As we take steps ahead, all of us must look at our own situations to see if we should take extra precautions, and at times we must remember those who are more vulnerable and help protect them. Viruses don't play fair. They are tricky and sneaky. There are some things we can predict about them and some things we never know for sure. That can be true of any virus, but this virus is new. We have no widespread, readily available, known effective treatment. We have no vaccine. We have no baseline immunity in the population. We've seen healthcare systems overwhelmed and a disturbing number of deaths in other places in our country. I've said it before that in public health, when your actions help, people question the need for those actions. Please know that we don't make these tough decisions without knowing that they have real consequences. But our responsibilities involve trying to do the right thing for Wyoming, and that's been our guiding principle. Thank you, Governor.